Let me take you back to an inauspicious moment in our political history. It is June 28, 2012. Just a bit of context. The Supreme Court rules on Obamacare. Take a listen.
The Supreme Court ruling on health care.
I am Diane Sawyer here with George Stephanopoulos at ABC News headquarters in New York. The Supreme Court has cast arguably the most important vote in a generation on health care affecting every single American. And George, it is
President Obama's signature legislation, and the Supreme Court has upheld the requirement that every American buy health insurance. We want to go straight to ABC's Terry Moran at the Supreme Court.
Well, George, we just got the opinion. I'm just taking a quick look at it. It's very long and a very brief look at it. Couple of things. The court says we are ruling in this case. They had a chance to punt. They didn't. The second thing is that Chief Justice Roberts says that the individual mandate is not a valid exercise of congressional power under the necessary and proper Commerce Clause. In other words, they struck down the individual mandate under the Commerce Clause, but then he goes on to say the individual mandate may be upheld within Congress's power under the Taxing Clause. In other words, very complicated. The court says the government can't insist that you purchase insurance, but it can tax you more if you don't.
So, Terry, they're saying basically it's giving you a choice. You don't have to buy the insurance. You can pay the tax, and that's why it's constitutional.
On the first 30 seconds of looking at this opinion, that's my take. It's like flood insurance. The government doesn't mandate that people who build homes on floodplains buy insurance, but they tax people differently who have insurance.
And Terry,
so they provide incentives and penalties.
This is a
6-3
decision?
Yes.
3 is Justice Roberts, presumably, but we're going to find out, weighed in on this. I want to go to Jake Tapper because I have to say he is the one person I know who was saying, watch out, I think they might uphold here because of things that he was hearing. And Jake, we're going to give Terry, who is an Olympic reader of long decisions, a little time to fathom what this means in terms of health and pre-existing conditions. But tell us about the White House.
Well, so far, no reaction from the White House. I imagine that, like Terry, they are wading through the legalese and trying to figure out just exactly what this decision means. If it is true that the U.S. Supreme Court, in a 6-3 decision, has upheld the constitutionality of the individual mandate, that would make this White House breathe a huge sigh of relief. Remember, this is President Obama's signature legislation for his first term. There is nothing that he put more heart and soul and effort into than this. And many presidents before him tried to pass health care reform. They failed, including President Clinton, most notably. But this president achieved it. Of course, it was a tough partisan battle for almost the entire fight. If it has been upheld, that does not mean that the political fight goes away. Mitt Romney and Republicans have said they are still going to try to repeal the health care bill in Congress. But if it's found to be constitutional, that is big, good news for President Obama.
All right, Jake, I want to go back to Terry because, again, this is real-time live, and he is going through it page by page. Terry.
So what they did, Diane, is fix the health care law constitutionally. The Chief Justice, joining the liberals of the court, said Congress cannot force people as a command to purchase health care, but it can tax people differently. What he says is, in this case, it is reasonable to construe what Congress has done as increasing taxes on those who have a certain amount of income but choose to go without health care. Such legislation is within Congress's power to tax. Essentially, they said, you didn't do it right, but there's a way that we can fix it.
And Terry,
so they upheld the Obamacare legislation.
And Terry, this is so interesting and ironic in many ways because all through this fight for health care, the White House was insisting that this mandate was not a tax. Then they went into the courts and argued that it was, and now it has been upheld because the court has decided indeed is a tax.
That's right. Actually, one day the federal government was saying, no, this is not a tax. And the next day they were saying, yes, it is a tax. The court didn't like that, but they fixed it. The government can tax you differently if you have solar panels on your roof or if you decide to engage in certain behaviors like smoking or other things. In this case, what the Chief Justice has done is say the government can tax you differently, impose a penalty if you don't have health insurance.
And Terry, I want to ask you about those provisions that are already affecting American families and their decision-making on health. Keeping your children on your insurance, pre-existing conditions, and as we know, women are charged more by insurance companies than men are. Does it address those?
Essentially, it upholds those. All those things that are in the Obama health care plan. Insurance companies will never be able to deny you coverage for a pre-existing condition. Women will be charged the same as men for health insurance. Right now, they're charged differently. Kids can stay on their parents' health insurance until they're 26. All those provisions and more, they will go into law over the next several months.
And Terry, the other big part of this was the expansion, the huge expansion of Medicaid in all of the states. It appears that that was narrowly upheld as well. I know you're just starting to go through this right now, but if that is true, this is a pretty sweeping victory for the White House in their position.
It is a huge victory for President Obama and for the advocates of that kind of national health care law. The court says the Democratic branches of government, Congress and the president, they figured it out. We found one thing wrong with it, but they can do the rest.
I want to go to John Karl, who covers Congress for us, and, by the way, read every single word of that 975-page Obama health reform. John, what is going to happen now? Is the House going to move to overturn this? What's going to happen?
Well, they will try, Diane, but let's be clear. What Terry is describing is an absolute thorough victory for Democrats here, whether you call it a tax or you call it a mandate. The law, as Terry is describing, is upheld. Republicans are going to be meeting shortly. House Republicans, Speaker John Boehner, gathering them together, plotting the next steps. What I was told before this came down is that they would be getting together and they would be plotting a strategy to take down, to destroy what is left of the health care law. They were widely expecting, Republicans in Capitol Hill, that the Supreme Court would knock down, if not all of the law, big parts of the law. That has not happened. They told me that they would come and try to take down whatever was left. But I've got to tell you, Diane, given the situation here, this law now stands, because the Republicans may be able to pass repeal of health care in the House, but they sure aren't going to be able to do it in a democratically controlled Senate. And even if Mitt Romney is elected president, even if the Republicans take control in the Senate, they will not be able to get the 60 votes in the Senate that they would need to knock down that health care law. So if this is indeed what we expect it to be, that the health care law has essentially withstood constitutional muster, it will remain the law of the land for some time.
It's becoming much more clear. I think we have David Muir as well. He covers the Romney.
Okay, let's fast forward to today. It is September 4th, 2018. President Donald Trump is named the healthcare industry's most influential person, and the Senate is resuming deliberations on a key funding bill. But isn't it a bit strange that the president would be extolled by the healthcare industry? Indeed, what would a sitting president have to do to earn such a title? Well, I'll tell you exactly what in just a minute. But first, the big news you never heard about, the new timing in a big Affordable Care Act case. The case is Texas versus Azar. For those of you who are unfamiliar with the name Azar, his full name is Alex Azar, and he is the Human Health Services Secretary. Unsurprisingly, he is a former pharmaceutical lobbyist and former drug company executive. Again, just a bit of context. Azar was nominated by President Donald Trump on November 13, 2017, and was confirmed by the United States Senate on January 24, 2018. He was formerly the United States Deputy Secretary of Human Health and Human Services under George W. Bush from 2005 to 2007. But get this, from 2012 to 2017, Azar was president of the United States division of Eli Lilly and Company, a major pharmaceutical drug company, and was a member of the board of directors of the Biotechnology Innovation Organization, a pharmaceutical lobby. The largest pharmaceutical companies and their two trade groups, Pharmaceutical Research and Manufacturers of America, PhRMA, and Biotechnology Innovation Organizations, lobbied on at least 1,600 pieces of legislation between 1998 and 2004, according to the Nonpartisan Center for Responsive Politics. Pharmaceutical companies spent $900 million on lobbying between 1998 in 2005, more than any other industry. During that same period, they donated $89.9 million to federal candidates and political parties, giving approximately 3 times as much to Republicans as to Democrats. Moreover, according to the Center for Public Integrity, a nonprofit investigation journalism organization whose stated mission is to reveal abuses of power, corruption, and dereliction of duty by powerful public and private institutions, from January 2005 through June 2006 alone, the pharmaceutical industry spent approximately $2.6 billion, that's billion with a B, on federal lobbying. The industry has at least 1,300 registered lobbyists in Washington, D.C. And to get some perspective on just how big that number is, consider that oil and gas companies and their trade associations spent $1.4 billion lobbying Congress over the same time frame, while the defense and aerospace industry spent $662 million, a fourth of Big Pharma's total. The huge sum of money our nation's drug makers lavish on Congress each year begs the question, what are they seeking in return? Surely it has something to do with the fact that our nation's legislatures turn a blind eye as pharmaceutical companies engage in predatory pricing practices while enjoying exclusive rights to manufacture drugs for 20 years or more with no competition. All at the same time that drug costs and drug price inflation are among the main drivers of healthcare costs for individuals and families and threaten the fiscal health of our public health care programs. Now, this is the dirty laundry of American politics, folks. This is really how the electoral colleges are won and lost. There's no need to imagine some foreign government or power tampering with U.S. elections when billions of dollars are spent each year to wrest away the power of democracy from the American people. So on September 5th, 2018, oral arguments sped up in Texas versus Azar. Arguments in a 20-state lawsuit challenging Obamacare, which was rescheduled for that date. But here's my point. Rescheduling the 20-state lawsuit meant it would occur at the same time as the confirmation hearings for Supreme Court nominee Brett Kavanaugh.
I am here today not because I want to be. I am terrified. I am here because I believe it is my civic duty to tell you what happened to me while Brett Kavanaugh and I were in high school.
I've never sexually assaulted Dr. Ford or anyone.
Mere coincidence? What do you think? And listen to their justification for moving it. According to the Texas federal judge handling the case, originally scheduled arguments were planned for September 10th, but the attorney for one of the parties in the case asked for a change because the Jewish holiday of Rosh Hashanah falls on that date. Now, this 20-state lawsuit you never heard about sought to invalidate pre-existing condition protections contained in the Affordable Care Act. A pre-existing condition is any disease or condition for which an applicant for health insurance has sought medical care. The lawsuit also sought to remove ACA provisions regarding community rating. And we talked about community ratings last week, but here's a quick refresher. Community rating refers to the setting of insurance premiums without adjusting for a person's health status. Texas being one of the 20 states suing the federal government to repeal the Affordable Care Act. Their argument was that the law itself is unconstitutional because the penalty for violating the requirement to buy insurance is no longer a tax. As I said in many episodes, your personhood in America is of little or no importance. You are either a voter or a non-voter, a taxpayer or someone who is exempt. You are either employed or unemployed. You are either insured or uninsured, while your humanity is completely ignored. So what started out at least rhetorically as health care for all Americans morphed into a health tax, or as I'll explain in greater detail, an exemption or a waiver. But wasn't this supposed to be about the health protections of Americans? Isn't this what the new majority House Democrats are all amped about? Pre-existing conditions? And why is that? Welcome to Urban X Real Talk Fitness Radio, where we challenge the fitness between your ears. I'm your host, Tiaja. Nearly a year ago, on December 22nd, 2017, President Donald Trump signed into law the tax reform bill called the Tax Cuts and Jobs Act after it passed both the U.S. Senate and the U.S. House of Representatives. And this tax reform bill made significant changes to the federal tax code. The bill does not impact the majority of the Affordable Care Act tax provisions. However, it does reduce the ACA's individual shared responsibility or individual mandate penalty to zero. effective beginning in 2019. As a result, beginning in 2019, individuals will no longer be penalized for failing to obtain acceptable health insurance coverage. So knowing this is the future of ACA, the majority-led House Democrats are now preparing to fight for pre-existing conditions, but on behalf of whom? Corporate interests or the American people? The stark truth is, much of Obamacare was nothing more than another hidden tax imposed on the American people, which is the lone reason why 40% of all people opted out. Most decided they would rather pay the penalty for being uninsured and take their chances at the ER. Meanwhile, while we were being preoccupied with the Kavanaugh hearings, the following was also taking place in the politics of pre-existing conditions. A Houston Chronicles article headlines a story regarding the malfeasance that led Medicare to pull funding for the prominent heart transplant program at Baylor State Luke's Medical Center. Also in California, Proposition 63, the Mental Health Services Act, steered billions of tax dollars to counties across the state to help fund treatment for the mentally ill, but huge sums of that money remains unspent. And finally, hospitals are starting to prescribe buprenorphine to patients with opioid use disorder in the emergency room to treat addiction. In other words, they are trading one pharmaceutically made addiction for another. And how are they pulling this off? Well, enter the Drug Addiction Treatment Act of 2000, which gives authority to the Secretary of Health and Human Services to grant waivers to physicians with certain training to prescribe and administer Schedule 3, 4, or 5 narcotic drugs for the treatment of addiction or detoxification. Now, prior to the passage of this law, such treatment was not permitted in outpatient settings except for clinics designed specifically for drug addiction. Now, the only qualifications, get this, for the waiver is an 8-hour course from one of the 5 medical organizations designated in the Act and or otherwise approved by, yes, you guessed it, the Secretary of the Department of Health and Human Services. Initially, the number of patients each approved physician could treat was limited to 10 for obvious reasons. This was eventually modified to allow approved physicians to treat up to 100 patients in an outpatient setting. However, this limit was further increased, by the Obama administration, raising the number of patients to which doctors could prescribe to 275. Now, we went from 10 to 275 in a few short years, and then we wonder why there's an opioid crisis in America. Now, is it just me, or did you hear about any of these pretty important issues on your local or nationally televised news channels? Yeah, I thought not. Today will be just another day unless you decide today that it won't be. It is Tuesday, November 27th, 2018. Let's flow.
After multiple political embarrassments, short votes, and wasted opportunities, Senate Republicans may actually achieve the impossible, killing Obamacare by turfing the individual mandate. The Senate tax plan proposes spiking the mandate that the Supreme Court ruled is a constitutional tax. Thanks, John Roberts. And although professional pearl clutchers and pathological hand-wringers worry mixing taxes and health care may be a toxic combo, they have to remember the individual mandate is, because of that ruling, a tax. And I know this is supposed to be about tax reform, which leads the frustrated chorus to shout in unison, "Why didn't you boobs think of this earlier?" Killing the individual mandate collapses Obamacare because now there's no mechanism forcing healthy people to buy expensive insurance they don't need. And you silly nitwits in Congress didn't think of this 4 months ago? Or 7 years ago? All it took was removing this Jenga block for the whole thing to fall apart, but it didn't occur to you, mouth-breathing simpletons, to take this one simple action? My God, you suck at your jobs. The worry is there will be more uninsured people, up to 4 million in the first year alone. That's too many people to fit in my crawl space. But in reality, it's just over 1% of the population, and most of those uninsured are foregoing coverage by choice. That's the dirty little freedom secret no one wants to whisper because it goes against the emotionalist narrative that health insurance is being cruelly ripped away from your poor, sickly, cave-dwelling, morphine-addled grandma. There are problems with this tax plan that need to be reconciled. This is not one of them. So make like Larry the Cable Guy and get her done. I'm sure there are plenty of opportunities for all of this to fall apart. And don't worry, I'm sure wannabe Senator Roy Moore will ride in on his white horse to save the day. Or not.
Here are my 2 cents, and feel free to keep the change. The Affordable Care Act can be broken down into 2 large divisions or buckets. The first division focuses on insurance reform, while the second on health system reform. Now, each of these segments are further broken down into considerable blocks. I'm going to share just a few from each bucket before giving my 2 cents. On the insurance reform side, there are 3 categories: more people covered, more benefits and protections, lower costs for consumers and government. And on the health reform system side, we have the following: improved quality and efficiency, stronger workforce and infrastructure, greater focus on public health and prevention. What is proposed for insurance reform are programs such as Medicaid expansion, kids under 26 cover, prescription drug rebates, Medicare Advantage, etc. On the health system reform side, there's community and school-based health centers, public education campaigns, public health workforce development, and nutrition labeling, etc. What really bothers me is that nowhere in any of these proposed programs and legislation is health-based initiatives that drive positive health outcomes. Let's get real here. In the next 24 hours, 4,660 new cases of diabetes will be diagnosed. That's more than 3 friends, neighbors, co-workers, or family members every minute of every day. Every 19 seconds, in fact. And it gets worse. Someone in the United States will develop Alzheimer's disease every 33 seconds. This year alone, Alzheimer's disease will cost the United States $277 billion. And this number is projected to rise to more than 1.1 trillion. That's trillion with a T by 2050, when 1 in 3 Americans are projected to be afflicted by this deadly disease. Ironically, this 1 in 3 number is the same ratio used to project the incidence of diabetes by 2050. Another coincidence? So let me ask you, what will nutrition labeling on foods do to reverse these abysmal prognostications? What kind of public education campaigns can be proposed? We certainly don't need another Hollywood actor advising us to reduce our carbon footprint by going vegan. And what about those proposed community and school-based health centers? What are they going to look like? What, more PowerPoint presentations and distributed pamphlets on how to incorporate more fruits and veggies into our daily meal plan? Look, no sane person would take such generic measures to fortify the foundation of their home if they knew it had been projected to collapse. But this is precisely what our government officials are choosing to do. Such measures are clearly designed to cater to the pharmaceutical drug companies and to protect the insurers from what the industry considers unreasonable disbursements. Now, I'm not trying to bore you to death with numbers, but at some point, we're going to have to get serious about lifting this veil of invincibility and secrecy that protects the drug companies, politicians, lobbyists, particularly the insurers, over American citizens. We must have a sense of urgency, a pushback against bureaucratic chicanery and greed. The financial crimes imposed on our minds and bodies in the name of health must come to an immediate end. There are self-care strategies you can implement tomorrow to improve your health outcomes, and I will be outlining many on our website at www.urbanxfitness.net, as well as our upcoming Urban X Fitness YouTube channel. See, because I truly believe that the next great revolution worldwide will be the revolution of self-care over healthcare. It is a trademark saying of ours, and I, for one, am determined to get as many people as I can to stand against the rising tide of politicians and healthcare markets that predict nothing but illness for you and me, as well as for our children. Dear friends, I wish above all things that you prosper just as your soul prospers. You've been listening to Urban X Real Talk Fitness Radio with your host, Tiaja. If you like the content we bring each week, then follow us on Facebook, Twitter, Pinterest, Instagram, Snapchat, as well as all of your other favorite social media. And while you're at it, hit that subscribe button or download our app at tiajae.podbean.com. Also, check out my latest YouTube channel titled T's Universe and his podcast titled T's Reverse. According to the comments I receive each and every week, both have been inspiring imaginations and creative protests of people all over the globe. And trust me when I say both are unlike anything you've heard before. So check out T's Universe every Wednesday at 10 a.m. Pacific Standard Time. It's 5 or so minutes that's guaranteed to change your life. And don't forget to stop through our website once again at www.urbanxfitness.net, where you will find our online stores for Urban Experience Fit Stores 1 and 2. And there you can download our unique home and gym workouts, our dietary menus, as well as purchase some outrageously bold teas and spark your own revolution of self-care. Also, check out our small library of hand-picked, personally endorsed nutritional products. They got it? Okay, they get it. Until next week, as always,
I got a degree now. I'm the bigot. I'm educated. You edumacated. So to you, I sound white. Why should the only language I speak be someone else's birthright? In the hood, I'm the misfit. Just to read and write, I need a work permit. I can't act smart around you or let on what I know. Maybe I'll head south to escape the new northern Jim Crow. To you, I'm an illegal alien, unfit, more money spent on your head, yet nothing's in it. Getting your hair did while poverty claims another black kid. Weaving in and out of blackness like an unsolved mystery. From afros to cornrows, told by the undertow of the current times, drowned by the undercurrent of the recurrent street rhymes. What the hell? You want me to walk through the same back door? Am I living in post-racial America or before? The same America with a facial, new expressions pasted on to look non-racial. It doesn't matter. It is what it is. It's a bird, it's a plane. Nah, it's just a little old whiz. So I do what I need to do to live another day. My code switching, I guess I did giveaway. Pondering how MLK became